fear-free. It's a philosophy, really. That's what it is. It's not a specific targeted set of instructions that have to be followed. It's more of a philosophy to try and make your dog or your cat's life as happy and comfortable as possible at the vet, no matter what it is they're going through, whether it's their routine vaccinations, or if they're really sick, or if they're injured, if they need to be hospitalized, whatever kind of treatment that it is. We want to make it them as comfortable, as relaxed and happy as possible even. So it's kind of a philosophy around the thought that actually vet visits don't have to be stressful for you as a pet's owner or for your pet. And actually they can be fun. And we definitely see that in our patients who and our clients who embrace this. We definitely see it that the dog comes in with a wagging tail. They're really happy to see us. They know exactly where that treat jar is. They don't mind anything that we do, and they go home just as happy as when they came in, or maybe even a little bit disappointed because they haven't got any more treats. Or the cat who happily comes out of their carry cage. They kind of prowl, they explore around, they let us do whatever they need to do without a fuss, and they're reluctant to go back into their cage because they're enjoying themselves and they're enjoying the fuss. So yeah, it's really a philosophy around that. But it all starts, I guess, with recognizing the signs of stress. Now, a lot of these, they're not rocket science, they're not really difficult to recognize, but if you're not used to seeing animals, I guess, in stress, if you're just used to seeing your dog or your cat relaxing at home, you might not notice that some of the behaviors they do at the vet clinic or in other situations as well. And these are important signs to think about if you're out and about with your with your pet. They're important signs to think about, just so that that maybe you're pushing things a little bit too hard, or there's things that you could be doing differently maybe. And yeah, the signs of stress, I guess, if we think of them as we think of adrenaline goes and we get the fight or flight response, but we can break that down into maybe the 4 F's. So fight, which is where your pet is struggling, maybe they're growling or hissing, they're snapping, they're baring their teeth. The flight response is a different one, and that's where they're trying to escape. Their ears are back, maybe their tail's tucked, they're looking around them, they're around their environment anxiously, kind of spying where those escape routes could be. And the freeze response, so lack of movement, unresponsive, they're literally frozen, or fidgeting. And this is a big one where you might not think that it's a sign of stress, but it's where they maybe seem even more energetic. They're jumping up, they're tail chasing, they're barking. And it might appear that they're being kind of playful, or they're wanting interaction, but actually they're fidgeting, and they're kind of like hyper aware, if you like, and they really are fidgeting as a sign of stress. So specifically to cats, panting, pacing, dilated pupils, elevated heart rate. Now, clearly you can't see that, but if you pick your cat up, and you can often feel their heartbeat, if you've got your hand under their chest, which is ideally where you should be supporting their body weight, you may be able to feel their heart kind of beating incredibly rapidly. They might be attempting to escape or hide. They're going to have a low body position, kind of an arched back. Their limbs and their tail are actually going to be tucked underneath their body. So you might not be able to see their feet or their tail. That's a sign that they are getting quite stressed. Their body might be tense as well, and they might just be kind of frozen, so lacking movement. And then the obvious signs of kind of more, I guess, aggression, kind of that fight response, is if they're growling, they're hissing, they're crying, that kind of thing. So with dogs, very similar, really. Panting, pacing, scanning, like we said, so looking for escape routes, just kind of keeping an eye on everything that's going on around them, especially if there's multiple different people. So your veterinarian, technician, vet nurse, other members of the family, just scanning around, keeping an eye on everything. Those dilated pupils, increased heart rate as well. Looking to escape, hide. Now, lip licking is one big thing that dogs will do. Yawning actually isn't on that list. That's another thing that, it's more a subtle sign of stress. But yeah, definitely one to look out for. They're going to keep low to the ground as well, potentially, or they might be quite upright and quite rigid. So they might have that kind of, contrast of things. And that's going to depend on each individual. And they may freeze and lack that movement as well. And then with that fight response, the barking, whining, growling, crying, trying to bite, really raising their hackles, that kind of thing. So when it gets to that stage, clearly you're going to recognize the fact that your dog is pretty stressed there. Okay, so let's move on to fear-free principles. So like I say, it's kind of more of a philosophy around how we manage things. So obviously it's very important that in the first instance we're recognizing signs of stress so that we can then take action at the earlier stages before it gets to the growling and biting and the more serious signs of stress there. But we need to consider your pet's environment. So that's the scent, the smell of the place, the sight, so everything that's going on that they can see, the sounds of the clinic, and also building up to the clinic visit, which we'll discuss in a little bit as well. Taste, so that's treats, primarily treats, but it might be medications that we're giving orally as well, for example, and touch. So touch is a big one as well. And when we think of touch in a fear-free situation, we're thinking of maybe a touch gradient. And what that means is that rather than kind of intermittently just kind of grabbing or touching different parts of your pet's body, they don't know where you're going to go to next, and that increases anxiety, especially if we're then trying to touch more sensitive areas. What we want to actually try and do is we want to maintain physical contact throughout the procedure rather than that intermittent touching. And then we start off with non-sensitive areas and gradually work towards the more sensitive areas. So the example would be when we first go in, we maybe kind of rub them under their chin, under their chest. We want to avoid in dogs and cats ideally kind of going over their head, which is often where people will pat a dog, is they'll go over their head and pat the top of their head or stroke the top of their head. But that's a really threatening movement for a dog and a cat to kind of be subjected to. So actually it might be just starting off on their chest and then moving your way down the body. So with your stethoscope, moving it from their chest and actually then to the side of their their thorax to listen, rather than just jumping straight in there. Then you keep your hands on the animal and then move it down to their abdomen, maybe to have a feel, or move it down their leg to see where they're sore, or to check between their toes, for example. So you're not just jumping in with those more sensitive areas that may be painful, or the animal just doesn't like touching. So that's really kind of one of the key principles of fear-free handling from a veterinarian's point of view. But that's something that actually discussing Renee's question later on is something to bear in mind and consider when it comes to trimming nails, which is what Renee's question is all about. And from the point of view of questions, as well as using the forum, and the forum, I kind of check that intermittently as we're going. But also, if you click through and watch the video in YouTube, then you'll be able to ask questions directly in YouTube, and that will flash up on my screen straight away. So just jump in if you do have any questions at all. So that's that. A few other fear-free principles, and I guess these are more training principles rather than anything else necessarily, but we've got classical conditioning. So that's the association of a stimulus with a learned emotional response. And that emotional response then becomes involuntary, a reflexive response. So if you think of it like a reflex. So I guess the classic is Pavlov's dogs. When that bell was rung, they associated that with food, and then they started salivating. So even when food wasn't presented, they eventually, when they heard that bell ringing, they started salivating in anticipation of the food. So the example here is if your dog or cat is really stressed by going in the car, for example, but every time they go in the car, in the case of your cat, they go in the cage, well, they learn to associate the stimulus, so going into a cage, with going in the car and being stressed. And so they get really stressed out by that cage, because actually that's the only time the cage comes out. So they associate the cage with with a negative stimulus, so going in the car, and so they get that negative emotional response. So that's where counter conditioning comes in, and I'm going to discuss that in the sense of getting your cat into their cage a little bit later. But counter conditioning, the aim of that is to change that emotional response from negative to positive, so that they effectively almost look forward to the cage coming out, because they know something good's going to happen rather than something bad. And we do that through desensitization, so just reducing the sensitivity or reactivity through gradual controlled exposure. So that means building up to starting off at a very low stimulus and building up. Another example would be, say, if your pet's scared of fireworks, those really loud noises, or thunderstorms, then you start off by playing those noises on really quiet levels. So it's not stimulating any kind of negative emotional response. It's even not even noticed. And then you're doing something fun while that's playing. As your pet becomes used to that, and if they're happy with that for a period of time, then you increase the volume and keep them distracted. And you never want to get to a stage where they're really stressed out by that volume, but then it gets to a stage where that volume is so loud it kind of effectively imitates real life fireworks. So when it is the 4th of July, which we've just had, obviously, or well, it's probably actually is. No, it's probably not the 4th of July anywhere in the world, because it's evening here. But anyway, so yeah, when it comes to the 4th of July or New Year's Eve or whatever it is, and the fireworks come, you've counter conditioned and desensitized your pet to those fireworks, so they're not as stressed. And we can learn associations with, with different things. So if your pet always associates the vet with something bad, well, actually, if we get them with food, with toys, we create a positive conditioned response because they're interacting with those things. Then again, that's kind of a counter conditioning, exercise. Excuse me, I'm just going to have a wee little drink here, and my throat's getting a little bit dry. Okay, that's a little bit better. I've also been reading my kids a lot of books at the moment. The weather's been fairly rubbish. We're getting through this Harry Potter series with my son and son Tom, and he's loving that. And we're on book 5. And Lucy has just got a load of books because it's the school holidays here as well from the library to keep her busy. So that's fantastic as well. So transport and vehicle prep. That's the next thing that we need to think about, because that's obviously something that you can do, and that's really important to think about, because often that stress starts when you're when you're first starting to think about taking your pet to the vet, especially for cats, because out come the carriers. But there's a number of things that you can do to make life an awful lot easier for you when it comes to even just getting your pet ready, and also just less stressful for your pet, so that they're not arriving completely stressed out to the max, before they've even arrived at the vet clinic, which just sets everything up for being a horrible interaction for your pet, and for you, horrible experience for you watching your pet be really stressed and maybe having to kind of handle them, and also for your veterinary team, might have to struggle and try and do the best that they can, depending on what it is that they're being seen for. So prep your vehicle. So have silence, familiar music on. You want to avoid startling noises, unfamiliar noises. Use sunshade so that they're not getting kind of overstimulated, or they're not feeling anxious because of that. The sight. So you remember that we need to think about all of the things in the environment, and then having an appropriate restraint for your pet. So for small pets, that's a carrier, a normal carrier, and we'll discuss what that means what a good carrier is in a minute. We keep that on the floor behind the passenger seat, ideally. For larger pets, we want them in safety tested restraints or crates in the boot. That kind of thing. We don't ever want any kind of pet free in the car, because that is a risk to them. If you do have an accident, then they're going to go flying, and will get in serious injury, also cause you serious injury. They could get under your pedals, could cause all kinds of problems. So never have your pet unrestrained. Also, when you open the car door for you to get in, or for you when you're getting out and you're at home, then you don't want them jumping out and going on the road and getting injured. And I actually had a patient, or maybe 6 months ago or so, who had a nasty broken leg because they were being taken. It was a dog. They were being taken out for a walk. They were loose in the car. The owner actually just opened the door for them to jump out, and rather than go straight into the house like they normally did, they saw something across the other side of the road, tried to run and get it, and were knocked over on the road. Now, thankfully, it was all a happy outcome, but it was a pretty serious injury, a lot of expense, and a lot of distress for that dog and for that dog's owner as well. So we never want a dog or a cat just loose in a vehicle. So for cats, we need to think about actually their carrier and what does that look like, what kind of features does it have, if you like. So it needs to be large enough for your cat to lie down in, to turn in as well. You want it front and top opening, because that makes it easier for it to be opened up for your cat to then be allowed to kind of have time to then come out of the carrier on their own accord when they're in the consult room with the veterinary technician or the veterinarian or nurse. We don't want to be kind of reaching in and grabbing your cat if at all possible, but we want to open it up as best we can. Ideally, also a removable top, because that then allows the bottom to be used as a bed. And also your cat can stay in it during exam. So using it as a bed is an example of desensitizing or conditioning in the first place your cat to that carrier so that they don't associate it with something stressful. So if you just take that top off, use the bottom half as the bed, then they're really just used to having that as a place that they go. They're safe, secure place. Once they're used to having that as the bed, you can even then put the top on and keep using it as their bed, but keeping it out all the time can make a real difference, because like I say, it's not then that it's just got out. You don't go and get the carrier only when they're going in the car to the vet or the boarding catcher or whatever, and there's only ever a stressful thing that happens when the carrier comes out. You want to make it so that actually the carrier is a normal part of the furniture. It's their safe space, they're comfortable with it, that kind of thing. So you can also put it in their favorite place, and when you're then using it as a carrier to go to the vets or to go to the boarding cattery or whatever, then have their favorite toys, have some bedding in it that's familiar to them, maybe with your scent on it. You could use an old sweatshirt or something like that, and make it warm as well, because cats like to kind of curl up in warm places. And then finally, when you're actually carrying the carrier, carry it by the base, not the handle. So carry it under the base, rather than by the handle, because it doesn't then swing. So if it's swinging, it's quite uncontrolled. Your cat's going to be rocked from side to side, and they're going to be really unsteady, and that's going to stress them out as well. So that's a few things for cats. For dogs, when it comes to traveling, like I say, never have them loose. So there's harnesses that you can have, that you can buy. There's carriers, there's crates as well, depending on the size of your dog, and the preference of your dog as well. So with the whole fear-free thing, is actually working with your pet, using their preferences, not forcing them to do things that they really don't want to do when there are alternative options. So if your dog prefers to be in a crate rather than in a harness, then using that crate. It needs to be comfortable. It obviously needs to be secure for your safety, for your dog's safety. Like I said, one thing to bear in mind when you're looking online, and there's a number of different places on Amazon, and Chewy and all these other online stores, as well as in pet stores, is that there's no requirement for harnesses to be crash tested. There is something called the Center for Pet Safety, and that runs independent testing. So there's that link there, and I can show you that website. So we don't want that free bonus, but you can see, they look at different crates and carriers. They look at different harnesses that they recommend, and there's a few different things there. So it's quite an interesting site. I haven't delved in depth into a lot of it, but yeah, they do these CPS approved harnesses. So that's something to think about if you're wanting to buy something, specifically for your dog. So hopefully with all those tips, you're going to help make getting your cat into the carrier in the first place, that vehicle journey to get to the vet clinic or wherever it is you're going, much less stressful. And then we're at the clinic. I can hide this. Let's just hide that. There we go. We're at the clinic, and there's a few just general tips once you get to the clinic, or before you're getting there when something bad's happening. So the first one, and this is one that I often suggest people do, especially when they've got a dog who is showing signs of anxiety. Cats, I don't suggest this quite so much, because often it's that stress of the car journey, and unfortunately most of the time people don't put the effort into getting their cat used to the car. So I guess the other thing that I could have said with getting your cat and your dog used to the car if they're anxious about it, is actually just saying, get your cat in the carrier, putting them in the car, closing the door, leaving them for a couple of seconds, opening the door, getting them back in the house, not even starting the engine, not driving anywhere, just getting them used to that action where actually nothing bad happens when they're in the carrier. nothing bad happens when they go to the car, and then they're back to their safe space, and they're maybe getting a reward, some something nice. You can then turn the engine on. You can then drive for very short periods of time, just a minute or two, and gradually build up. So that's that desensitization that we spoke about at the very beginning. It's got a whole load of different ways that we can use that theory and that idea to try and make life a lot happier and a lot less stressful, a lot less fear and anxiety for our pets. So yes, have socialization visits before anything needs to be done. So if you're, I guess we recommend this with puppies. If we're having puppy parties, puppy classes in the clinic, they're great. They're not the be all and end all for socialization by any stretch of the imagination, but they definitely make a dog love coming to the vet in the future. And we'll see this in dogs when they're elderly. If they've been to puppy classes, they've had a great fun with a load of other puppies, they've made good mates, they've had a lot of fuss made out of them from the nursing, the reception team, from the vets, whoever's there, then they don't mind the vets for the rest of their life. It's a little bit of effort, but it goes an awful long way with making everybody's life a lot easier and improving the level of care potentially that your pet might be able to receive, which is something I'll come on to a little bit later as well. But you can absolutely do that with cats, but you need to get them used to the car journey first. And like I say, that's something that often doesn't happen. Other things that you can do. So you can bring the favorite treats from home. So if you know that your dog loves something, if you know that your cat loves a certain treat, it might be that that's not a treat that's used by your veterinarian and it's not available in their hospital. So bring it from home. Again, so that's something that that they'll like. It's a high value reward. So when you're using treats as a distraction, then that it's going to work potentially much better. Cats, when you get there, keep them off the floor. Cats like being elevated. So a lot of clinics, certainly newer clinics these days, it's a bit difficult for older clinics depending on space and all that kind of thing, but they'll have cat separate waiting areas or even separate waiting rooms. They might have places where you can put the cage up off the ground, so that cats like being up high. It makes them feel safer. Also, it's away from dogs, which clearly is a big source of stress. If you've got some kind of dogs coming up and sniffing their cage, there's nothing more stressful to a cat than that. Cover their cage with a towel. Spray that towel with pheromones. Not spray your cat, spray the towel with pheromones, which I'll talk about in a bit as well. And face it towards the wall so that they're feeling secure, not overlooked. And also the dogs aren't able to look in the front of their cage. For dogs, we want a fixed lead. We don't want retractable leads. They're dangerous. They cause all kinds of problems. They're not great at controlling your dog as well. So a fixed leash, but keep it loose. You don't want chokers either. You can think of body wraps. So what's it called? It escapes me. So you've got body wraps. So it's like I'm just trying to remember the brand name. But I can't think what it is. So basically it's like a really snug fitting swaddle, if you like, in effect, that you put on. It's I'm sure it'll come to me, the name, but anyway, so it's like a swaddle, and that pressure, that gentle pressure, can really help reduce stress. We use it a lot in maybe firework phobias, noise phobias as well. But that kind of thing. You can maybe have a pheromone collar, a favorite mat to lie on. That's something else that you can bring for your dog to just reduce their stress. Another thing to think about is owner anxiety can increase pet anxiety. Absolutely. So dogs and cats are very good at picking up on social cues. And if you as their owner are feeling really anxious, stressed, scared, whatever, then that will really kind of transmit to your dog and make them feel more anxious. So when we're doing anything in the consultation room, or if your pet needs a procedure done of any description, it might be that they're actually better off with you in the consult room. But if you're feeling stressed and anxious by everything, then actually they can pick up on that, and it can be better if you leave the consult room or they're taken to the treatment room to have that procedure done. And actually it can be much less stressful. And I certainly have patients where they're almost impossible to examine in the consult room. They're so anxious, because their owners are so anxious because they know that their pet's anxious, and kind of everybody feeds off everybody else. But actually, if we then if we separate pet and owner, we can do almost everything that we want to without, with much lower stress levels from everybody. So sometimes it's better to stay with your pet or your pet to stay with you. Sometimes it's actually much better and less stressful for them to be taken to the treatment room, or for you to just go out to the waiting room for a period of time. And that's going to vary really by pet, by owner, by procedure, all kinds of different things. But then the final big tip, and I guess this is one of the big you kind of fear-free principles, is that we don't want to push our pets unless we absolutely have to. So if they're starting to feel stressed, if their stress levels are climbing and they're getting above a certain level, they're not responding to treats, we're not able to do things safely and in as stress-free a manner as possible, then we might want to consider aborting that procedure, whatever it is that they're in for that day, changing the plan of how we manage that the next time, so that we can get it done at another time in a less stressful manner. So I've got that consider wants versus needs. So we might want something to happen. You might want your pet to have a certain procedure, but actually it's something that can be delayed. And while that might mean another consult needs to be scheduled, it'll mean that there's extra cost involved, obviously, but it doesn't need to be done. And the real reason that this is very important is also that if something is stressful and we keep on doing it, and often we can just keep on and we can get the job done, but what's going to happen next time is your pet is going to be even more stressed and they're going to be harder to do anything with at all. And that can absolutely get to a stage where it becomes impossible to provide any meaningful sort of healthcare to an individual animal, because they are so wound up when they come into the clinic. They're so aggressive that we need to sedate them or anesthetize them to do absolutely anything. And there are definitely patients that I've had that needs to happen. And that's fine, we can do that. But if it comes to your pet having a condition, and I've got one patient that springs to mind here, this is from a number of years ago, it's probably from 7-8 years ago. It was a dog that was so aggressive with us, we couldn't do anything with it unless its owner was present in the room. And actually, this is an example of the dog was much better with the owner than when they were removed from the owner. But this dog was diagnosed with acute renal failure, so its kidneys were shutting down. And it needed, some pretty intensive, ideally, it needed some pretty intensive hospital treatment, needed to be hospitalized for a number of days, if not longer, and treated aggressively. But there was no way that we could do that because it wouldn't have been safe. This was also a big, I can't forget the breed, but it was a big dog. It was probably 50, 60 kilos. So there was no way we could safely handle that dog in the clinic. So we tried to treat it, and we did as best, we did as well as we could, and looking back, there's nothing else we could have done. But unfortunately, we weren't successful with that treatment. But that's the reality of what can happen if we push our pets too much. If we're just getting things done, we're pinning them down, we've got all hands on deck to do something, it's only going to get worse with time, and it's only going to make life even more difficult, and that can have some serious consequences down the track that you may not anticipate at the time, thinking it's a relatively simple procedure that you just want done. Anyway, so that was a little bit of a rant, but that's why that's important. So let's move on to other things that we can do to keep our pets calm and reduce their stress levels and keep them as calm as possible before we even get to the clinic. So we can set up the vehicle, we can have everything ready, we can also give various supplements beforehand. So pheromones, so that's our dog appeasing pheromone. It's called Activil, or it's Adaptil. It used to be called DAP, and unfortunately that's the only name that I can ever remember. It's Activil. I think it's Activil or Adaptil. It's one of the two. The other one's a flea treatment, I think. And with cats, it's Feliway, which is feline facial pheromone. So these are pheromones that are naturally produced by, well, in the cat's case, it's when they're rubbing their cheek up against items, they're marking their home territory, their safe territory, their safe space. With dogs, it's actually a pheromone that's released by the nursing female dog. That makes the puppies kind of bond with her, makes them feel safe and secure and home as well. So those are the two pheromones. They come in a plug-in diffuser, so you'll often see them in the veterinary clinic. I can almost guarantee you that they will be in every veterinary clinic in one place or another. but you can also get sprays, kind of little sprays, so you can spray that onto towels, onto bandanas, into cages, that kind of thing. So that's a really good use there for travel. And with dogs, you can also get a collar, so it's with them all the time, which is really good for our anxious dogs. So there's a couple of different things there that we can use. There's alpha casozepine, which is a milk protein, and the trade name for that is Zolkine. There's maybe others, but Zolkine is the one that I'm aware of. So that is actually kind of broken down into a chemical that's like a benzodiazepine. So it's an anxiolytic, an anti-anxiety medication, and that's been shown to work. There's a supplement called L-tryptophan, L-theanine, which is a green tea derivative. There's various botanicals as well. Carmex is one that we'll use. And there's also music therapy, which isn't really a supplement, but if you've got classical music on, not rock music or thrash metal or anything like that, but classical music has been shown to have a calming effect. So they're all things that you can think about administering to your dog before that stressful event. Now, depending on what it is, what product you're using depends on, how soon before the event it should be administered. Often it's an hour or two, or it could be that you're actually doing it for a few days building up to that event. And then there's other accessories that you can have. So we've already talked about body wraps, blankets, towels with their home scent on it, with your scent on it, if it's an old jumper or jersey or something like that. The body wraps that we've spoken about, that I still can't remember the names of. The eye covers, white noise, can help. Cage covers as well for cats, just so that they're not being looked at. The dogs aren't kind of sniffing and they can't see those. Head halters for dogs, that can just help improve control in a gentle manner to make life easier and quicker, and so less stressful. And also basket muzzles. Now, that's an accessory that you might be a bit confused by, because we're talking about fear-free, and we actually associate as people putting muzzles on dogs that are aggressive so that we can do things to them without us getting hurt. But actually we should be conditioning dogs to having a muzzle put on so that they're not associating that muzzle with going to the vet and having something painful done. They're associating it with getting treats, for example. So we want to condition your dog to having a muzzle put on. And this isn't for all dogs, but this is for maybe anxious dogs that have maybe then shown signs that they might be, kind of getting up there in their stress levels. So have the muzzle on. Once that muzzle's on them, what that then allows whoever's doing whatever job to do is they're more comfortable, they're less anxious because they're less worried about being bitten, which is a risk of the job, but it's not an acceptable risk. It's not something that we just need to pass off as, oh well, vets, technicians, nurses get bitten. We shouldn't do. If we're getting bitten, then we've read our patient wrong and we've been doing something wrong. But it will allow them to be more calm, get the job done more efficiently and faster, with less kind of faffing around, less uncertainty in how they're approaching the patient, which then feeds back into the dog. So a basket muzzle can be a great addition. But then I've got their pharmaceuticals as well. So there are various other pharmaceuticals that can be used that your veterinarian might prescribe. So gabapentin is one, ACP, dexmedetomidine. There's a whole load of different things, diazepam, lorazepam. Yeah, there's a whole range of different procedures. Melatonin is another one, which is kind of a supplement, I know, but because you can buy that from the pharmacy or off the shelf. But I'd be using those things only in conjunction with your veterinarian. But there's various other things that your vet might give you, knowing your pet, knowing how stressed they are, and maybe knowing what procedure needs to be done. If a painful or a more uncomfortable procedure needs to be done, then it may be beneficial to have some kind of pain-killing pre-treatment on board before, if your pet gets stressed by everything. And that's where if you can kind of if things are getting really stressed, then consider aborting and changing a plan. So it might be that your pet's never had something done before, they've never been particularly stressed, but when that is attempted, they get really stressed. Well, the next time that plan can change. So we consider some of these supplements, we can consider pharmaceuticals. There's no one size fits all with supplements and pharmaceuticals. So I think that's everything. So I'll jump back onto full screen here. So it's often a case of just working out what works for your individual pet. and seeing what the response is, and then changing the plan in the future depending on how they respond. So for some dogs, it might be that one particular medication, they're super calm, they're super chilled and relaxed on it. In other situations, in other pets, it might be that they have that same medication at the same dose, and actually it does very little for them. So there is quite a lot of trial and error, or trial and improvement, if you like, about that. So I guess those are the big take home. So I hope that's been kind of interesting in regards to what fear free is, and how that can impact you as the owner, and the things that you can do, because it really is a two-way street. If you've got a pet who is fearful of anything, it's not going to get better with time. It's not going to get better without a concerted effort to improve things, to make things less stressful, to desensitize your pet to whatever it is that's causing them stress. And this is the same with any kind of behavior problem. So I'd always say you need to recognize things in the early stage, and then make those changes, and make a concerted effort, be consistent with how you're doing that. And you'll get there, and you'll make life better. And it will work. Sometimes, certainly if the stress levels are really high, your pet is really triggered very badly by something, it's going to take an awful lot of effort. With other behaviors, you may need to, get involved with a behaviorist, a trainer, to get some one-on-one coaching, to go through a real plan and have a lot of follow-up. But fear free is, it involves that. And ideally there are things that you can do, with getting your cat used to their cage, with the socialization visits, with puppy classes. There's things that you can do in the first place to actually stop, or prevent, or greatly reduce the chance of your pet ever becoming fearful in the first place, which would be fantastic. Excuse me. Okay, so that's kind of the end of everything that I wanted to speak about. Like I say, if you've got kind of questions, head over to the message board in the academy. I'm just checking it again now, just to see if there are any questions there. So I've got questions from Renee. So thanks for your questions, Renee. They're great. And valuable for everybody, I know. So the first question is, what are the biggest differences between exam handling procedures of a fear-free vet versus a non-fear-free vet? And the answer is a wishy-washy. It depends on the vet, I guess. So I was kind of pleased, I guess, when I went through that fear-free course, and got the certification. Actually, a lot, if not most, of what I was doing or am doing has not changed at all, because I was following those principles. And I think a lot of that comes with experience, with being able to read our patients a little bit better. And I guess one big advantage of the fear-free certification and the training being formalized, if you like, is that for people who are maybe earlier in their career, who are less have got less experience with reading their patients, because ultimately that does come with time and practice and exposure to different animals and all these different experiences. You kind of, you learn to read a pet's feelings by, a quick glance. You don't even need to spend any time, and it's all done subconsciously. So I guess a lot of what I would have been doing anyway, I wouldn't necessarily have been able to verbalize, to explain what I was doing or why I was doing it. Whereas, now having gone through this course, I'll be able to verbalize it, although I'll be doing exactly the same thing. So it really depends on your vet. You'll also, I guess the flip side is, if you've got a vet who's been graduated and been practicing for a longer period of time, it may be they become set in their ways. And certainly the old way of doing things was, it was almost like a badge of honor just to get things done. Or I can wrestle with this difficult dog. It doesn't matter how big or how aggressive they are. I can get that, that job done. And, owner gets sent on their way, happy that the job's been done. That's, clearly a little bit of a, well, it's an awful lot of a negative thing to do. That's not the right way to put it, but that's only going to lead to more problems later on. It's not really the ideal way we should be going about things. And I think there's been, that great shift in the mentality of, maybe the profession. So it's not seen as a badge of honor. But if you've got an older vet, it might be that they're pinning things down. It might be that the younger vet feels pressurized to do things because the owner comes in wanting a certain job done. They've been booked in, and your next question is about nail clips, which is a great example. They've been booked in for a nail clip. and they feel pressure to have that nail, to have all um, all 18 nails clipped, or 20 nails, depends on dew claws and things like that, but have all the nails clipped to an appropriate length. Whereas if the dog's feeling super stressed, or your cat's feeling super stressed, after that first claw, they're not confident enough in their relationship with you as the pet owner, maybe, to say, well, actually, we need to leave that for now. We need to reschedule for another time here. This is how we can think about getting your pet used to having their feet touched. These are some of the actions that you could take before coming in. These are the supplements, these are the medications, this is what we're going to do. So there's maybe a confidence in managing the situation as well. And again, that's something that it does come with a little bit of time and a bit of confidence, and with having built up a relationship with with clients already as well. So how does the examination differ otherwise? So we've got that gentle touch, that kind of touch gradient that I touched on at the beginning, no pun intended, where we're just maintaining that contact rather than kind of going in and touching different parts of the body without seeming warning. That can cause an awful lot of anxiety. That'll be different. There'll probably be a lot more treats involved, or there may be a lot more treats involved. As I've gone through my career, I certainly find myself getting through more and more treats faster and faster. So we're not shy of giving treats. We're not shy of using Kongs, licky mats, licky pads, other food puzzles, toys, distractions. I'm using those to distract our patients. So you might find more of those in use. You might find that a lot of things are done on the floor, where maybe other people are picking them up on the table. Certainly, dogs, they will often prefer to be on the floor. They'll almost always be on the floor. Now, there's a little bit of a compromise sometimes, certainly with small dogs. Doing things on the floor can be really challenging, just because your head's right on the ground, and we've got to look after our backs and knees and all that kind of thing as well. So it's easier and more comfortable for us to do things on the table sometimes, but equally we'll be doing a lot of things maybe more on the floor. With cats, they might prefer being high. We ideally prefer cats to come out of the cage by themselves rather than go in and fish them out. So there are a lot of differences there, but it's really going to depend on the vet, because it's not as simple as saying, well, a fear-free certified vet is doing all these things and a non-fear-free certified vet isn't doing them. I think that's doing a lot of disservice to the non-certified vets out there, the great vets that are out there that haven't been through this program. And also, just because you've been through the program doesn't mean that you've actually put anything into practice that you've learned. You may be using it as a marketing tool, for example, and saying, well, I'm fear-free certified, or the practice. And certainly in the US, you can have practices that are fear-free certified, but if they're just doing it as a box tick exercise so that they can say that in their on their website or on their promotional material, then actually being fear-free certified is of no use to their patients, because they're not putting everything into practice. So like I say, it's more of a philosophy, and I think the fear-free certification, it formalizes that, and it might be something to look for if your pet is anxious, and you're maybe not getting some of the the attention or the suggestions of how to change that. Maybe then looking for a fear-free certified veterinarian or clinic would be something to think about. But yeah, it's very much on an individual basis. I guess that's my kind of not so short take on it. So I hope that answers your question, Renee. Leave me a comment in the forum if you've got any follow-ups from that one. And then, do you have any specific tips that we can use while giving our dogs a nail trim? Yeah, absolutely, I do. And actually, as part of the fear-free certification, so we have that initial certification. Then after a year, you can do an extra, I think you do a level 2, and then a year later, you can do a level 3 certification. But there's also lots of individual courses that you can do kind of as add-ons. And actually, I've just done my fear-free nail trim. When you asked that question, I thought I do have some tips anyway, but I thought I'd run through that course, that hour course for you, just to see what it is. So you'll excuse me, I've just kind of written some notes here that I didn't have time to type up. So I guess the big one is don't just get it done. So like I've just said, if we're forcing things, we do lasting damage. So if you're just trying to get things done at home, your pet really doesn't like their feet being touched, but you're just going to do it. Maybe your partner's going to pin your dog down or your cat down, and just get the job done. It's only going to make it worse. So if you find yourself doing that, stop and take a step back, take a deep breath, and put the nail clippers down, because it's also going to damage kind of your pet's bond with you as well. And we need to think, why is nail care why is kind of nail care and having nails clipped so stressful? Well, there's increased touch receptors in pets' feet. So just like our fingers on our hands are more sensitive, it's the same with your dog's feet. So they're much more sensitive. So if there is anything that happens that's painful, it's actually then going to be more intense. They're going to feel more painful than you might imagine. It's like if you prick your finger with a pin, it's going to be really sore. But if you prick your thigh with a pin, or your shoulder with a pin or something like that, you might not even feel it, for example. So that's a difference there. Many pets, they're also kind of ticklish. So just like if you're getting your kind of your feet touched and it's really ticklish and that's uncomfortable, this can be the same for your pet. And also by holding your pet's feet, holding their legs, you remove their ability to flee, so that they can't get away because they're being restrained, even if it's just holding one leg. And so then, that is an anxiety causing effect that has. And so they may be more likely to then struggle to even, start mouthing, growling, biting, all that kind of thing. And then if we're thinking of nail clippers, and there's various different types that I'll talk about in a minute, but it's novel sounds and sights and things. So if you're using grinders, there's a lot of whirring, vibrations. The nail clippers, that kind of clip of the nail can trigger them. So that's all things to think about. And if we're thinking of things from our pet's point of view, then it allows us to understand why things can be stressful for them, and why they can be cause discomfort, even pain, and it allows us to better address those to make them more comfortable, or less anxious when they need to happen. So how often should we clip our nails? Now that's a different one for every single dog and cat. It depends on their activity levels, what surfaces they're doing those activities on. Maybe look at your pet's nails every 2 to 4 weeks. For some, that might be incredibly excessive. For others, that 2-week period is definitely something that they need to be addressed, because what we want to do is we want to maintain them regularly. We don't want to do it once a year when they're super long. Then the quicks have grown. It's more likely that you're then going to catch the quicks if you're using nail clippers. It's going to take an awful lot more effort to then trim them regularly to get those quicks back. So we want to be doing it really regularly. And if we're trimming, only taking very small amounts off, or only needing to take small amounts off, so that again, those quicks aren't growing. So sometimes you'll get these our older dogs and cats, and unfortunately in cats we do see it from time to time, where the nails are completely growing around and then growing into the feet, causing horrible wounds, infected wounds and abscesses. Just think how painful that is every time your cat walks, but they might just be putting up with it. You might not even notice it. For dogs that are older and arthritic, especially, if their claws are long, it splays their toes, it pushes them up whenever they're walking, and it makes life really uncomfortable on joints that may be arthritic and sore at the best of times. So just doing it regularly, it helps avoid that. Now, as well as having an appropriate nail clipper, we need to have a few other supplies to hand. So you can have like the quick step, what's it called? I've got it written down. We use it kind of zinc sulfate pens. Styptic powder is what it is, and that's something that just helps to clot the blood faster. So have that to hand. Have some scissors maybe, so that you can trim the fur, so that you can actually see what you're doing. Depends on how hairy your pet's feet are. And have a good light. So either a good lamp, a head torch or something like that, a headlamp, just so you've got some good light, so you can actually see what you're doing, which obviously really helps. So don't be afraid to stop. I've already covered that. So when it comes to the best clipper type, now everyone's got their preferences. When it comes to clippers, there's ones that look like scissors, or there's ones that are so-called guillotine action. I personally really don't like the guillotine ones. I don't find that they cut very well. I find that they can be a bit more uncomfortable for our dogs, cats less so. But yeah, I just don't prefer them. Some people really do prefer them, but yeah, there's the guillotine style. There's the scissor type, which can be sized appropriately. So you've got big chunky ones for our big dogs, kind of smaller ones for our smaller dogs. You've then got very fine ones for cats, and I definitely, like to use the most appropriate sized one for the individual. The important thing with guillotines or with the scissor style ones, is to keep them sharp. So if they've been used for quite a while, then it might be that you can sharpen them, or it might be that you actually just need to get new ones. So you want them to cut, you don't want them to crush, because one of the disadvantages of nail clippers is the squeeze that they have of the nail, which can be very uncomfortable, and that can then trigger kind of anxiety and fear and things, even if you're not getting there quick, you're not catching there quick. But if they're nice and sharp, they'll cut through nicely without that squeezing action. Also, the with the scissor action, you want it to be nice and tight, so the bolt often, and you probably need to use it quite a lot, but I certainly notice these sometimes when the ones in the clinic are getting past their use by date, that bolt, the action between the kind of the shearing action, they just becomes a little bit loose. So rather than being a nice action like that, there's a bit of a gap between, so they don't cut as well, and then they're squeezing. So just basically have nice, sharp, well maintained equipment is important. When you're using clippers, you want to just take off small bits at a time, especially if the nails are long. You don't want to just go for a big bold cut in one go. You just want to slowly work your way up, because it might be then that your pet starts to object when you're getting a little bit close, without then cutting the quick, and it will allow you to get closer. And if you get close to the quick, that will then allow you to push that quick back. If you get really close, the quick will kind of shrink up. If you actually catch the quick, it doesn't cause it to shrink up like that. So it's definitely, if you've got really long nails, some people will say, well, just cut them really short, just get it over and done with. Even if you're catching the quicks, because they'll then get shorter, but that's not true. You need to avoid getting those quicks. It's also incredibly painful. Imagine if someone kind of pulled your nail off, it'd be very sore. And no wonder that your pet will then object from then on in. Now, another way to do it is grinders. So the Dremel tools, that kind of thing, your hand tools that are a hand kind of sander. They can be great. So you're much less likely to damage the quick, to cause the pain there, but they're noisy. They can generate a lot of heat if you're holding them in one go onto one nail for a long period of time. So only do it for short periods of time and different nails, so that you're not getting that heat build up. The noise, the vibrations can be quite scary as well. It does take longer if the nails are long. If there's a lot of nail to remove, it does take longer than the clippers. And then the other option is files. So you can get files. Obviously, they're just like nail files that you might use. They're better for maintaining short nails rather than trimming long nails. So if you're doing it very regularly, then a file might be all that you need, just to keep things nice and short, nice and trim, and not overgrowing. But if they are overgrown, then files probably aren't the best thing to use. Another, I guess, the last kind of couple of points really, when you're actually trimming the nails, how you're handling your pet is very important. So not, we need to think of their comfort. So not pulling their legs all the way to the side, because that is not a normal action for a shoulder or a hip to go through in a pet. And it's uncomfortable for them. It's not a natural thing that they'll be doing. And also not stretching all the way out. And especially if you've got an older pet who may have some underlying arthritis, then that's going to be really uncomfortable and painful for them. And another reason why they don't like it, let alone the fact that their feet are more sensitive and they may have had a bad experience. And then lastly, desensitization. So going back to that desensitization, if they've had a bad experience, they are showing signs of anxiety, we want to get them used to, in the first case, just having their feet touch. So we start off, if we're thinking of that touch gradient that I spoke about, starting off at their chest, moving over to the shoulder, and then working down the leg to then touching their feet. And it might be that you only get to their elbow, for example, on their front leg, before stopping, giving a treat, and doing that a few times, and then that's that session. And over the weeks, you get them used to then getting closer to their feet, then having their feet touched. Maybe you just examining their nails, not going anywhere near them with clippers or grinders or anything like that, and then getting used to them, you touching their feet with nail clippers in your hand, or maybe getting them used to just the noise of the grinder from a distance, before then bringing that closer and closer to them. So it's a really slow process, but one that's definitely worthwhile doing if your pet is anxious, because nail care is something that is often going to be needed, clearly, especially as a pet gets older. Even if they didn't need their nails trimmed regularly when they were younger, as they get older, they probably will. So it's definitely worthwhile, persevering and going through things, even when they're younger.